In nature, spiral patterns reveal the harmony between form and function. From galaxies to seashells, they show how growth follows simple, universal laws. Today, we bring that same principle to the cornea. Using spiral dynamics to guide lamellar dissection in DALK, we apply nature's geometry to restore clarity and vision. Our patient developed acute hydrops 3 months ago. Now that the episode has resolved, we proceed with DALK surgery. OCT imaging reveals a thin central corneal scar located at the apex of the cone. In this case, a big bubble cannot be achieved. Instead, we inject air using a 30-gauge needle beveled up to create stromal emphysema, facilitating a smoother and safer lamellar dissection. After removing the superficial stroma and assessing corneal thickness, we create an entrance with an NBR blade and begin stromal dissection following a spiral pattern. The central area is carefully preserved to be removed at the final stage of the procedure. It is very important to leave the central stroma for the final stage, as the Descemet membrane break that caused the hydrops is located in this area. Our goal is to reach the deepest stromal layers, ensuring the best possible visual outcome for the patient in the future. Intraoperative OCT provides an extraordinary view of the remaining stromal layer, clearly showing an intact Descemet's membrane. This is one of the reasons why I recommend that patients wait until the hydrops has completely healed before proceeding with keratoplasty. This approach increases the likelihood of performing DALK instead of penetrating keratoplasty, thereby reducing the risk of graft rejection, and allowing for a faster and safer visual recovery.